So yesterday, we started a new topic in practice of medicine, that is pulmonology. Okay. So today in the pulmonology, we started with basic anatomy and physiology. So basic anatomy and physiology yesterday we talked. Today furtherly we'll discuss something new about lungs. Okay. Physiology. That is defense mechanism of lungs. Because the defense mechanism is very important. So we'll discuss defense mechanism of lungs. DOL, defense mechanism of lungs. So basically, the lungs, the air coming from the outer environment to the internal environment. Okay. So in that air, we have difference of things. Like we have uh, particles, dust particles. Okay. Any pollen particles. Okay. Bacteria, virus, or polluted air, carbon monoxide, which is coming from the vehicles, which is very, very harmful to the body. Okay. Mostly coming from the vehicles, two-wheeler, four-wheeler, bikes, cars, etc. So there's the reason nowadays most of the people affected with lung diseases, heart diseases, central nervous system diseases are mostly attached to the polluted air or polluted water. Okay. So basically, our body, and it means our lungs breathe daily 20,000 liter of oxygen per day in 24 hours. Means 20 kg, or you can say uh, kg if you calculate in uh, kg, 20 kg or 20 liters. Sorry, 200 to 20,000 liters. Okay, 20,000 liters. So this is the highest amount. So that's the reason the lungs need protection. It needs defense mechanism. What it needs? It needs defense mechanism. So respiratory system have inbuilt defense mechanism. What it have? Inbuilt defense mechanism to protect from toxic particles. So inbuilt defense mechanism to protect from toxic particles. So whatever toxic particle, it may be through the dust, through the pollens, through the mold, fungi, bacteria, and we have other things which cause harmful effect to the body. So lungs have defense mechanism, okay, inbuilt defense mechanism. So one type of defense mechanism is like whenever dust come into our home, what we will do? We will sweep, okay, with the help of anything, whatever in our home we have. Okay, likewise, we will comb our hair. Okay, what? Because if any dandruff like thing or any thing which present in the hair will remove, mostly for female because they have to comb daily or every second day, because they have long hairs. Okay, likewise, in the lungs we have cilia. What we have? We have cilia. We will see the image also. Cilia. This is the first type of defense mechanism. Primarily, what it will do? It will wipe the tiny projects which is present in the lining of the airways. So these are the tiny muscular projection. This is the tiny muscular projection which is present in the airways, which is present in the airways. Okay, so let's see the image of the cilia. So you can see that this is the cilia. This is the if this is the airway. Okay, movement of mucus to the pharynx. So this is the particle. Okay, this is the mucus cell. This is the mucus layer. This is the cilia, epithelial cell, because every uh, organ, mostly respiratory system, already you study in anatomy and physiology, that uh, lungs and stomach are all covered with epithelial cell. You have stem cell also. After this mucus cell will die, then another mucus cell will come. This is the lamina propria. This is the basement membrane. Okay. So we have all this. So in this, we have important is cilia. What it will do? It will fight. What it will do? It will wipe like. Okay. So what it will minimum wipe for 1,000 times per minute. It moves, or like the wind comes, and will see the uh, leaves will move from downwards upward. Likewise, it will move. Okay, 1,000 times per minute. Okay, and mucus will move from 0.5 centimeter to 1 centimeter per minute. Okay. So along the trachea or bronchial tree, primary, secondary, tertiary, bronchial, okay, bronchiole, bronchus, okay, alveoli. So from that level, gradually it will move towards the trachea. From the trachea, okay. So in that mucus, what will have particles? Already you studied, we see the image, we saw in the image. Pathogens, maybe pathogens, because the particles have pathogen also. Okay, that those are trapped in the mucus. So it will send to the back to the mouth for splitting, or else we will swallow. What we will do, if the lot of amount of mucus is coming, we will split away. Okay. So the mucus will tell us the mucus is normal or not. If it is white color or light milky color, it is normal. If the mucus is changing, it is thick, dark milky color, or dark yellowish color, secondary dark mild color of mixing of blood in the mucus, or blood is coming. So it means there is damage in the internal organ of the lungs. Okay, so it is very important. Mucus will tell us the internal structure of the lungs. So normal mucus will have all these things. So next, this is the first defense mechanism. So basically you have 2 to 3 types of defense mechanism to protect the lungs. One within the structure of the lungs, that is cilia, and second one is within the lungs we have phagocytes. What is that? Phagocytes, which will travel throughout the lungs or respiratory system. Okay. Okay. So it will, what it will do? It will, the name of this thing is phagocytes. So what we will call phagocytes, which these are present in the surface of the alveoli. So this is the alveoli we have, like grapes on the surface, above the surface of the alveoli. We have what we have? We have phagocytes. What they are mobile cells. Means mobile cells means they will travel throughout the lungs. Again, they will wandering from one place to another place. Okay. So what they will do, they will see the particle if they are making dangerous thing to the lungs, what it will do? It will damage. If the thing is damaging, so what they will do? They will attack on the bacteria, attack on the fungi, virus, okay, and they will kill the microbes, okay, whatever the deposit particles, and they will kill the bacteria. They will engulf, they will digest them. So what we will call the another name of this phagocytes is alveolar macrophages. What the other name is? Alveolar macrophages. So what? So we have to know about this macrophages. We can see with our naked eye macrophages. Okay. So this is the second defense mechanism. So let's see the image of macrophages in the. So this is the structure of alveoli, single alveoli. So you can see that this is the alveoli. This is the uh, blood vessel. So blood vessel is attached to the alveoli. This is the deoxygenated blood, and oxygen is adding, carbon dioxide is leaving from the blood vessel. Okay, exchange of gases will happen here. Okay, this is the respiratory membrane, fluid surfactant. We have type 2 cell alveolar macrophages. You can see that this is the macrophages. It will absorb. Oxygen is going to that area, to the blood vessels. It will wander. It will, like camera, they will work. Okay, if the macrophages occur, they will digest, they will kill them, and they will digest them. So this is the second defense mechanism. So first defense mechanism is we have cilia, okay, and second is alveoli macrophages. And third, if we inhale any type of toxic substance or any type of dust or anything, so the third different type of defense mechanism which is present in our blood vessels, that is neutrophils will activate. Okay, if any serious threat to the lungs, so we have neutrophils. We will talk in detail in immuno diseases. Okay, so the WBC, white blood cells, will act here. In the WBC, we have five types of cells: neutrophils, eosinophils, basophils, lymphocytes, monocytes. Okay, all those will activate according to the condition of the disease or condition of the material, microbes, pathogen, anything. Okay, so here, if the large amount of infection will occur, large amount of alveolar macrophages are increased, WBC increase. Okay, so what will happen? There is a big war will happen with our defense mechanism with microbes. Okay, so this is the defense mechanism of the lungs, which will protect day and night to the body. Okay, which is very, very important. One is cilia, and another one is alveoli macrophages. Already we saw in the image. You can see one more time here. This is the cilia. Okay, you can see defense mechanism. Okay, so now we will talk about respiratory system, how the body affect. The respiratory system is also affected. according the age will increase, likewise other organs will have the effect. Likewise, our lungs will have the effect. Right. Cardiac issues, our digestive system will decrease, our eyesight will decrease, hair fall will happen, white wire will come, walking style will change, weakness will come. So everything will decrease as age increases, as age increases. So age increases, functions decreases, structural changes will happen. So it is the degeneration of the stage. Okay. So at that time, when person walks, person talks, he will need more oxygen, more inhalation. So the aging will affect on the respiratory system. So mostly old people have pneumonia. Okay, the respiratory muscles is also become weak, like intercostal muscle, diaphragm, and breathing difficulty will occurs. Okay, any structural changes will happen whenever they will do exercise, walking. So they will have the shortness of breath. Okay, their respiratory diseases will occur anytime whenever the seasonal changes occurs. Okay, so this is the age affecting on respiratory system. So at that time period, we want to know about we how to tell the person to protect from the all the things which affect the respiratory system. So nowadays, from past 2 to 3 years after COVID, there are number of persons affected with respiratory system diseases. So we have to study about that. We have to treat the patients with electrophysiology. Okay. So here I will explain one thing. That basically what does lungs contain and what type of remedies we need. Okay, but remedies now, oh, and I will not able, I will not tell you that. Things is that the lungs from the nostril to the alveoli. Okay, this is the respiratory system. We have that in that respiratory system, lungs are made up of muscles. Okay, some parts are made up of cartilage like trachea and ligaments. Okay, and we have arteries, we have veins, and cartilage, nothing but like we have larynx, pharynx, all that also made up of cartilage. Veins means blood supply, and there is nerve supply, and in the electrohomeopathy, lymphatic supply, because mucus, this is lymphatic supply only. So in the electrohomeopathy, there is an equilibrium in the lymph and blood is a health. If any disturbance occurs in lymph and blood, it means this equilibrium of lymph and blood is disease. What we will call? We will call disease. Means that if these things are affected, arteries, veins, nerves, lymphatic channels, or lymphatic things, means the disease will occur in the respiratory system. So already you told, oh, we know about that the cilia is protecting and the macrophages, alveolar macrophages is protecting WBC is protecting WBC. All these things are present in the lymphatic channels. Mostly in the WBC, some things also present in the blood also. Okay, so we need, and we have mucous membrane and epithelial tissue, and we have the covering the layer, mucus layer. Okay, pleura. Okay, and we have ribs, and we have muscles, intercostal muscles, and diaphragm. So basically, in the lungs, the problem will within these things. So we have to know the remedies which affect those parts. Then the disease is identified. In that disease, what type of things are involved in the respiratory system? Only single respiratory system is affected, or other than respiratory system, other systems are also affected. Okay. Likewise, we will add upon the remedies. Okay, this is the simple and basic idea which I am giving to you. We can choose the remedies. Okay, if we are like a person have cough, but there is no things, nothing in the respiratory system, no problem. But even though we have cough, so it means that this is the problem of central nervous system. Cerebral system, psychotic cough also, psychotic cough. Central nervous system is trying to understand there is a problem in the lungs and it is expelling through the means of cough. Okay, so it is decided through the nerves. So we need to treat with the help of nerve. Here we have to add F1 definitely. Without adding F1, you cannot treat the patient. So likewise, we have to understand the reason behind the problem within this things. So we can treat the problem easily. First, we have to understand the disease. So the disease, in which level the disease is affected, so we can easily treat the patient. So I think this is the basic of the coming series of classes. So I think you understood. So if any doubt, kindly ask.